getting vaccines, and I go to the counter medications, prevent sickness.
Okay.
I would say public health is the sector of healthcare that deals with health on the community level instead of the individual level. So it works to prevent infections and illnesses that happen on a global scale and on a community scale.
Public health means to me the health of the public.
I think public health is like just how healthy you are.
Is the sector of medical care that makes sure people are living healthy lifestyles.
I would say it's the well-being of the community.
What does public health mean to you?
Public health means general welfare.
I think it is the health of the public.
Okay.
Public health is a science of prolonging life, preventing disease, and promoting health. This includes social and behavioral changes, statistics, as well as environmental factors.
Where it's disease tracking and trying to find the cause of the disease and where it started and stuff. And also tracking morbidity and mortality for life insurance and health insurance. But basically it's to track in an epidemiological sense the etiology or the cause or the origin of the disease. And also you can predict where it might strike again, or given certain indicators.
Right?
Yep.
Hi, what's your name?
Connor Parsons, the Food and Beverage Director at the Courtyard Charleston Historic District.
Okay, can you tell me, what is public health to you?
To me, public health is the study of different diseases and the people they affect and how it happens, the ways that those diseases come about. Especially in Charleston, different socioeconomic backgrounds. You never know what's going on to affect those different groups of people with certain diseases.
And how do you contribute to the public health?
As a food and beverage director, it's mainly foodborne, bloodborne, airborne pathogens. You want to make sure that the food is safe, the drinks are safe, the contact surfaces are safe. Anything we can do to prevent the spread of different diseases from our hands, from our bodies, from different parts of food.
Mm-hmm.
Preventing that spread to people is a big deal in food and beverage.
Is there any certifications you have to go through, or any?
Yeah, so myself being ServSafe certified, it's a long course where they talk about all of that stuff. Public health's a big section in there, just making sure that, they teach us about all the diseases, they teach us about how to control them, what they do, and just basically the risk factors and how to control them.
And one last question for you. Do you feel like you make any contributions to public health outside of Charleston? Or?
Definitely. My contribution to public health outside of Charleston, working in a hotel, is ensuring that the guests who come in from all over the country, all over the world, go back to their respective cities, states, and countries healthy. If we do our part here, then they're going home healthy, and we don't have to worry about spreading anything like that.
Great. Thank you so much.
You're welcome.
Okay, so what's your names?
I'm Rachel.
I'm Laura.
And what do you guys do?
We are Cougar counselors. We're certified and trained volunteer peer counselors.
Okay, so what does public health mean to you guys?
So I guess when I first heard it, my immediate reaction was about reducing the stigma for mental health, but that's probably because we're Cougar counselors and we deal with that a lot. So that's kind of what I was thinking.
I was thinking kind of more of like it's just general it's like a generalized sense of health, so it's more of like a bigger umbrella, so it can kind of cover different aspects of all different forms of health, if that makes sense.
Yeah, public awareness for all types of health, maybe?
Yeah.
So.
Yeah, mental, physical. Are there any others?
Okay, so what is your role in public health then, since you guys are counselors?
I think we have multiple roles here on campus. One that I'll talk about, at least as a role, is kind of lowering some of the stigma or talking about mental health in general on campus. We do a lot of like tabling out in Cougar Mall or on Rivers Green, talking about different, awarenesses that are going on, whether it's eating disorder awareness or suicide awareness, those kinds of things, and just educating people a little bit on what that is and what signs to look for, how to help a friend, what to prevent, and also helping the conversation flow on a campus to maybe lower some of the stigma.
Yeah, and I think to like bounce off that, just because we table a lot for things like that, but we also like to get people to know that like counseling is healthy and that there shouldn't be a stigma around going to see a counselor, whether it's a peer counselor like us or a doctor or something like that. So
that there's someone that walks on campus every day.
Yeah, and we have CASAs right next to us too, who they deal with like if you can come see us for like a couple of times or something, but sometimes we refer people over there just because like they should have more counseling than us.
If it deals with like psychosis or something, if someone thinks they may be struggling with depression or anxiety, they may want more of a licensed counselor who can have multiple sessions with just them and build off of each session, whereas for us, we can deal from issues from my roommate ate my yogurt to, I'm having thoughts of suicide. But even if a student comes in with thoughts of suicide, we try to refer over so that they can get so that they can get continued help, because it's always beneficial to maintain a positive, healthy mental health constantly.
Okay, well, thank you guys.
So, can you tell me your name and what your job is?
Yes, my name is Brittany Douglas, and I am a family nurse practitioner who works at Minute Clinic inside the CVS pharmacy.
So, what would you say is the definition of public health?
Public health, to me, my knowledge of public health, is a group of health professionals who basically focus on group health, health of communities, large amounts of people, by focusing a lot on prevention, by providing vaccines, also surveillance of the community as far as outbreaks of certain communicable diseases such as measles, mumps, STIs, that kind of thing, and also providing treatment for some of these things. But their big focus is on prevention and education as far as community awareness of these types of illnesses and issues.
That's great. And so what would you say your role is specifically in public health?
We often refer people to public health for various things. We provide vaccine services here, so we do a lot of those, but sometimes, especially with people who have no funding, they're unable to pay your insurance, they often can get those services for much cheaper at a public health facility such as the health department. And I refer, like the other day I had a patient who had a positive TB test and reached out to one of the DHEC nurses who handle that, and they were able to connect with that patient and do further testing to see if that was actually a public health risk, if the patient had an active TB and needed treatment, or whether it was just an exposure or something.
All right, well, that's great. Thank you very much.
You're welcome.